Hi, everyone. I'm Dr. Debbie Smers, and I'm excited to introduce you to the Peptide Reset program. So, what we're going to be focusing on this program, yes, it is weight loss, but we're also looking at an anti-aging and brain health. So, we're going to be looking at it from a biohacking tool. So, this is a structured wellness program, which is going to be medically supervised. We're going to be doing personalized dosing, most likely microdosing, and we'll talk more about that. We're going to give you lifestyle strategies to help you reset your metabolism, reduce inflammation, and support your cognitive vitality. Now, this program is about 20 years in the making. I have been dealing with weight loss first as a personal trainer, a fitness instructor, and now as a naturopathic doctor for at least 20 years, as well as someone who's had to watch what they've eaten very closely their entire life, because I too find it very difficult to lose weight and very easy to gain it. Now, it was really after I studied with Dr. Tina Moore, and I realized that there was a missing piece to the weight loss journey. And it's pretty exciting that we now have access to GLP-1s and GIP, so different peptides, which can be a game changer. Now, they're not the magic bullet, but they definitely are a tool that we can use to help us in our biohacking, brain health, weight loss, anti-inflammatory journey. And I'm excited to tell you a little bit more about it. So I designed the program and I brought Karina, our nurse practitioner, on board. She's the one that throughout the program is going to be prescribing you the peptides. She can also help with hormone optimization. So can any of my naturopaths, but she's going to bring us a wealth of knowledge when it comes to metabolism, as well as making sure that all of your hormone numbers, all of your liver enzymes, all of the blood work that we want to get tested, it's in the optimal dosing. So we're going to be working as a team. And here's a few more people on the team that you might meet along the way. Now, the fact is that weight loss is hard. If it wasn't hard, there wouldn't be a $260 billion market around it, which is expected to get up to 532 by 2032. Now, add in inflammation, add in aging, add in menopause, and losing weight is like trying to carry that boulder up a hill. It's possible, but it's really hard. And it's not just about aesthetics. It's not just about how we look. Weight loss increases your risk of chronic disease. It's one of the reasons that I'm so passionate about helping people get to their weight goals so that we're not going to see chronic disease. And it's not just about self-control. We now know that when it comes to hunger hormones, when it comes to weight loss, there's a whole hormone dance that's in play. You've probably heard about insulin, ghrelin, and leptin. But what you might not have heard about are incretins. So incretins are produced by the gut, and that's what causes insulin to be secreted by the pancreas. And what are incretins? They are GLP, ones and GIPs. So these are naturally occurring peptides in the body. The only difference between the ones that you've heard about, like Ozempic, tirzepatide, is they've added a molecule onto it in order to allow us to make it last longer in the body. So incretins are naturally occurring peptides in the body. If you're here, it means that you're interested in the peptide program that we're going to talk about today. I strongly encourage you to watch this video. So pause me, watch this, and come back. If you're still interested, then click forward. What this is going to tell you a little bit more is the biochemistry of peptides, how Ozempic works, why it might be for you, and why it might not be for you. So a very important next step is to watch this video. So what is the GLP-1 program I'm talking about? So it's medically supervised and it's designed to support weight loss, metabolic health using prescription peptides like semaglutides and tirzepatides. Now, if you're not interested in the GLPs, that's great. You do not need to. We can still help you. We have a whole weight loss program. But what we're talking about right now are people that are interested in using the GLP-1 programs. We will be microdosing. So that means we're going to start low and go slow and customize your dose based on your specific needs. We're going to be using the peptides as tools. I have written a customized app that's going to help you with motivation. It's going to help you with diet. It's going to help you with making those decisions on the fly. It's also going to be helping you with recipes. So we're going to be holding your hands along the entire journey. And we're going to bring the knowledge that we've spent the last 20 years creating to you in this program. Because really, what we need to make sure we do is we protect your muscles, we protect your hormones, we decrease inflammation, and we make it that you're going to be doing all the right things for full longevity. Because that's what I really want to focus on. I'm a longevity anti-aging doctor, and weight loss is one piece of it. So here's how the program's going to work. First off, you're going to watch the orientation video, the one I showed earlier. There's then a qualifying form because it's not for everyone. So we want to make sure that you qualify for the program. Once you sign the consent form, you then have an optional call with our clinic coordinator if you're still not sure if Ozempic's right for you. Once you're ready, you're going to have an initial peptide consult with one of our naturopathic doctors. It's going to be around 30 minutes, depending. It's going to be a little bit different for everyone. But here we're going to determine what type of metabolic profile are you? Because when it comes to dosing, we have 3 different types that we want to think about. Have you been doing everything right and you just have a few things to tweak? Or has there been a lot of metabolic problems for a long time? And that's going to determine what kind of dose we want to think about when it comes to starting the GLP-1s. Once you've had that meeting with the naturopathic doctor, you're then going to meet with our nurse practitioner, who, if she decides we need to do more testing, is going to send you for blood work. And she's going to be the one to prescribe. Naturopathic doctors do not have the ability in Canada to prescribe peptides. So that will be on our nurse practitioner. Once she's going to write the prescription, once you've received it, we're then going to have an injection visit. We strongly encourage you to have this in clinic if possible. Otherwise, we can supervise it through a video call. But we want to make sure that you're doing it properly, you understand exactly what's going on, and we can see you do it the first time. We're then going to have weekly email check-ins. I want to understand if there's any kind of side effect going on, if you're feeling gassy, bloating, anything else that might be hindering your experience or hindering your goals. And monthly, we're going to have naturopathic check-ins so we can make sure that we really get you to the place you want to go. And then every 3 months, you'll be seeing the nurse practitioner so that we can re-prescribe or change your dosing accordingly. So who is this program for? This program is for you if you've tried diet and exercise, but your body still isn't responding the way it wants to. So if you've never dieted, if you've never exercised, or you're not doing it now, this isn't the place to start. We want to make sure that you're in a place. That being, unless you're finding you can't exercise, maybe because of joint pain, which might go away with the GLP-1s, we'll see. So typically, our patients are over 35 and are starting to notice stubborn weight gain despite healthy habits. Hormones might be at play, stress might be an issue, inflammation might be part of the problem, you might have hit a plateau, but the biggest thing is that you're ready to invest in your health. Now, not just for weight loss, but to feel energized, clear-headed, and strong again. And not just invest financially, but invest in time and effort. If you aren't in a place where you have the time and effort to focus on it, don't focus on weight loss. You're going to simply set yourself up for failure. So this is not for you if you're looking for a quick fix, a one-time shot, or you're not ready to change your habits alongside the GLP-1s. What makes our approach different is most clinics offer GLP-1 peptides as a quick prescription. It's 15 minutes, maybe they'll do some blood work, and then you're on your own. For maybe 3 to 6 months, that's not what we're doing here. We built a comprehensive physician-guided program that combines medical insight, naturopathic care, diet, lifestyle, motivation with personalized dosing strategies. We're here to help you change your life, change your habits, and look at longevity and overall wellness. It's not just about weight loss. We're going to be microdosing and cycling so that you don't have to keep going up and up in dose. You're going to meet with our team that's going to teach you about motivation. It's going to teach you about diet, lifestyle, and putting all the pieces together. We have a whole person approach. So we're targeting all the different areas: inflammation, hormones, mental, motivation, brain health. And you're going to get ongoing education and accountability. I want to see that email come in that's showing me that, yes, you're exercising. Yes, you're staying on track, so that we're not just simply waiting to see what's happening. We're giving you motivations. We're shaking our pom-poms. We're giving you strategy and making it that you are successful. So some of the things that patients have said that have been on this program: the food chatter is gone. Many people used to snack at night and now they're not. One of my patients told me just yesterday that she's really impressed how much her desire for alcohol has gone down. She always socially drinks, and now she can just have one or two, when before she would find herself having three or four. Joint pain, muscle pain, that's probably the first thing that people tell me, even on a very low dose, that that pain's gone, which means we can possibly start exercising if that was one of our obstacles to success. Most of patients notice steady, sustainable weight loss. More energy, that's one of our goals. We want to make it that you have more energy so you can move, so we can get you in a metabolically healthy place. And very noticeably, many of my patients are saying, I've never been able to lose weight yet still have muscle retention or even gain before. Yet I'm feeling like I'm getting stronger and stronger. Now, this is just what our patients are telling us. You're going to be a little bit different. What's the investment? So we're going to ask for an initial $250 sign-up fee. This is going to cover your appointment with a nurse practitioner, access to our Natliving app, the GLP-1 workbook, diet and exercise program, weekly emails, as well as all the administrative work. The rest is going to be pay as you go. So when you pay for naturopathic appointments, it will be pay as you go. And for many of you, that will be able to be covered through your insurance. So once you include the cost of the GLP-1 peptides, it's going to be around about $1,000 for about 6 months, give or take. And your insurance is going to cover the majority of these for most of you. So what some of our patients are saying, one of my patients, I worked with Dr. Debbie in the past. She knew her obstacle to success was nighttime snacking, but she couldn't do it despite restrictions during the day and exercise and doing intermittent fasting, but that's now completely gone. Someone else who said, I never knew that this is how people feel. This is what normal people feel like, to not be fatigued, to not have that crash when it's time to start, when they need food again, was the way they described it. They said to me, I didn't know that this is how everybody else feels. I have such a crash when it comes time to eat that I have no energy. I now have sustainable energy all day. And of course, the confidence, knowing that you're being medically supervised every step of the way. So the next step is to click on that link if you're interested, and let's get started. Let's fill in the application form and have you watch the video. Thank you so much, and I look forward to working with you.